Hi, everybody. My name is Michael King, and I am joined here by one of our doctors, Dr. Neda Siddiqui. Dr. Siddiqui, how are you today?
Hi, Michael. I'm great. How are you?
Fantastic. And if you're watching this video, chances are you are interested in laser vision correction. And our goal is to be able to provide you answers to the top 10 questions about LASIK. And so if at the end of this video or after watching any of the individual videos, you find that you'd like to know, are you a candidate? We'd love to invite you into our practice to come visit us, where we can be able to have our doctors to take a look at your eyes and make sure that you're an excellent candidate for laser vision correction and talk about all your options. So with no further ado, I'd like to jump into our first question. And this is one of the more common questions that patients have, which is LASIK safe? So when a patient asks us that question, Dr. Siddiqui, how do you answer that to them?
Actually, I think this is the most important question that most patients have, and LASIK is safe, yes, especially with the newer technology, with the eye tracker, with the fact that everything is done by the laser. Basically, it's all laser LASIK these days. The laser flap is definitely more precise and it heals better. And so, yes, LASIK is safe. In fact, it's one of the safest surgeries in the history of all surgeries.
Question two is another common question that patients have. It's a very natural question to ask if you're talking about surgery to your eyes, and that's, does LASIK hurt? So what's your response to a patient asking you that question?
LASIK surgery does not hurt. However, you will feel pressure during the surgery and you will have enough numbing drops not to feel anything. But if there is any irritation, it's mostly because of the fear factor, but LASIK surgery does not hurt. There's no pain as far as the healing is concerned. Basically, the most common side effects are dry eyes, which is a part of healing process, and sometimes glare and halos, and nighttime vision fluctuations.
Excellent. The next question we have is another one that is a very common question that patients want to know is, are there any side effects from LASIK? So what are some of a potential side effect that someone can have by having this procedure done?
Again, the only side effects that patients usually complain about are, number one, dry eyes, which is again a part of healing process, and you just use artificial tears for a while until your body gets used to it and it heals and you get rid of it. The second most common complaint is nighttime vision fluctuations, which also gets better with time.
Our next question is, can LASIK treat astigmatism? This is a very common misconception people have, that LASIK cannot treat astigmatism. So Dr. Siddiqui, when someone asks that, how do you respond to them?
So LASIK can absolutely treat astigmatism. No matter how much astigmatism you have, LASIK can treat up to a certain amount, of course. So yes, LASIK does treat astigmatism.
And if you're wondering exactly what astigmatism is, it's when your eye is shaped a little bit more like a football than a basketball. And so that's causing light rays that are supposed to be landing on your retina to land on multiple focal points, essentially causing that blurriness in your vision. But don't worry, almost everybody has astigmatism, and it is absolutely treatable as well. Our next question is a very common question I'm sure that many of you have, is how much does LASIK cost? And to be able to answer this question, I want to give a little bit of background of what you might be seeing when you are doing your research for laser vision correction. And it's a little bit confusing when you see stuff like $295 an eye or $220 per eye, these crazy sort of low prices, which, to be fully transparent, well, we don't, first of all, do that type of advertising, but also it's a bit of just a way to kind of, make the phone ring at those practices respectfully. And the vast majority of people, if you're looking industry-wide on a nationwide level, you should expect between $3,500 to $4,500 on average, give or take, is the fee that you should have for top quality laser vision correction, for your eyes. And anything less than that, I honestly, that's just not the pricing that we see. But the last thing I would mention is that we have awesome zero money down, 0% interest financing options for you to make it really affordable with your budget. Our next question regards recovery time. So when a patient asks us, what is the recovery time and how much time do I have to take off of work? How do you respond to that patient?
Usually the recovery time with LASIK is about 3 to 4 hours. You go home after the surgery and you have your eyes closed for about 3 to 4 hours. And after that, you can basically hang out, you can watch TV, you can eat. And most patients actually drive to work the next day.
Next question regards the differences between LASIK and PRK. So for those patients that are curious about this question, what's our response to them?
So PRK is also known as surface ablation. Basically, PRK is done on the very surface of the cornea, and LASIK requires a flap. So the reshaping of the cornea is done under the flap with LASIK. Sometimes patients do not qualify for LASIK surgery, and that's when we switch to PRK. And as far as treatment, laser treats both of them. However, the recovery is a little bit longer with PRK.
Excellent. And we'll be able to provide you with more information when you come in for your consultation to let you know after we've gotten all the measurements, which one's the right one for you. Next question is, for those of us who are past the age of 40 and we're kind of having the issue with reading vision, common question is, well, will LASIK correct my reading vision? How do you respond to them?
It does. We have options, of course. Anyone who's over the age of 40 has options with LASIK surgery. We can either correct both of your eyes for your distance vision or do something called monovision, and that will definitely give you near vision. The near vision you had before the age of 40 will kind of give you that back, which is a great feeling. And it's very convenient, and a lot of patients love it.
Yeah, and so if they want to learn a little bit more about monovision, what would you suggest to them? Just to ask you during the consult, or how do they find out more about that?
Yeah, absolutely. When someone comes in for their free LASIK evaluation, we go through all of that. And I actually show it to them so they can see their options before they can make a decision.
So very common question patients have is LASIK permanent, or do I need to have this done multiple times? So what's your thoughts on that?
A great question. So LASIK surgery is permanent. However, sometimes our bodies are not, and we're dynamic. And if something happens, like for example, if there's diabetes or high blood pressure or anything like that, of course, it could cause the vision to change after a while. And sometimes it does change, unfortunately. However, with LASIK surgery, usually patients require to have it done once, and that's it.
Yeah, and if you were to need to have a second correction, absolutely, we're there to take excellent care of you. It's called an enhancement. The vast majority of people only have it done once, but we'll be able to make sure that you're well taken care of at our clinic. Last question in our top 10 questions about LASIK is what's the next step? Like, how do I know if I'm a candidate? So for somebody who's interested in finding out more, what's the next step for them?
So if someone is interested in LASIK, I definitely recommend for them to come in so we can do a free LASIK evaluation for them. It's very easy and it's quick. We can just do a few testing and tell you if you're a good candidate or not. And then we give you all the information about the surgery, what to do before the surgery, what to expect afterwards, and you can make an informed decision about it.
Excellent. So on behalf of all of us here at International Eye Care, I want to thank you so much for your interest in laser vision correction, and we do look forward to seeing you when you come in our clinic. Bring along any additional questions that you may have, but until then, have yourself a wonderful day, and thank you very much. Bye-bye.
Thank you. Bye-bye.
All right.